Hi there, this is Mark Idelman, speech-language pathologist, and welcome to the teaching of talking. This video is number 3, and it addresses the prognosis for improvement of speech with speech therapy. Now, many people who have strokes and aphasia and apraxia are very much surprised when this occurs, and they have very little information, and quite often one of the biggest arguments that they have and one of the most major criticisms they have is that often they're not consulted, they're kind of left out of the situation. And one of the things that caregivers want is they want increased communication with healthcare providers so that they can get a better idea of what's going on with the stroke, with the aphasia, with the apraxia, what the prognosis is, how long it may take, all of those questions. So this particular video is going to be about the other aspect that determines how long it may take and what the prognosis may be. And this particular video is about the type of aphasia that the person has, because the type of aphasia or the type of apraxia a person may have will also determine how long it's going to take and will also determine what kind of results one can expect. Now, there are many people who can improve speech to the point where it's really functional, where they can use their speech again. And in some cases, there are just some who just are not going to be able to for any number of reasons. So we're going to talk about the kinds of aphasias and apraxias there are and why that also determines the prognosis and the length of care. So first of all, when a person has a stroke, and if they have aphasia, then we know that they have difficulty initiating speech. Now, in aphasia, there's all kinds of severities. There's a mild case where they have intermittent difficulty recalling words. There's a moderate to severe case where they have a lot of difficulty expressing themselves and finding the words. Sometimes they even say words that aren't really appropriate, but they come out anyway. And then there's the severe to profound aphasia, where a person just isn't able to express themselves at all in spoken language. So the severity of the aphasia will have a profound effect on the prognosis, how long it's going to take, and what the chances of recovery are going to be. Remember, that's going to depend on the severity of the aphasia. And in cases of aphasia, there's mild cases where they have intermittent recall difficulties. There's mild to moderate where they have a lot of difficulty saying sentences. And then severe to profound where sometimes speech, they can't even initiate speech at all. Okay, so the second factor, we just reviewed the first one, that there are different kinds of aphasias and different severity levels. So, of course, if a person has a profound aphasia where they're not initiating speech at all, it usually takes a lot more work than someone who's got a mild aphasia. So the more severe that the problem is, typically the rule of thumb is that the longer it usually takes to correct. And then I must admit that sometimes you never really correct it. Sometimes you improve it considerably. And the amount of improvement that a person has depends on how long they work on it. Now, many of you may know of Kirk Douglas, who passed away in the last year. And he used to always say in his lectures and in his books, because he had a stroke, and he used to always say that he'd ask his speech therapist frequently, how long am I going to have to be in therapy? And the therapist said, well, probably the rest of your life. He had a very severe problem. He had a very severe dysarthria. And so therefore, the more severe a problem is, usually the longer it takes to get a hold of it and to get a significant improvement. Now, he was able to significantly improve his dysarthria, Kirk Douglas was, But still, you could tell that he had a speaking difficulty, but he was able to make his needs known, and he was able to tell people what he wanted to say to them. Now, so apraxia is another problem that people with strokes have, and sometimes they just have an apraxia, or sometimes they have an apraxia and an aphasia. So if you have an apraxia and aphasia, you have two different speaking difficulties going on at the same time. And usually one must address the apraxia before you can address the aphasia. The apraxia, remember, is that the tongue and the lips and the teeth, they have difficulty formulating the speech sounds. So they're very, very slow, and they can't make very coordinated efforts. So when they attempt to speak, the speech comes out somewhat garbled because of the motor speech problem. Now, if you have an aphasia and an apraxia, that's going to take even longer to correct because you usually have to address the apraxia first. Now, in some cases, you can address them both at the same time, but if they have a severe apraxia, you've got to fix the apraxia. You've got to get those speech sounds to where they're accurately said. Once they can accurately say those speech sounds, then you can put the sounds into words and work on the language. So, in the treatment of aphasia and apraxia, it's not a quick fix. I've been working with some people 2 and 3 years. They made tremendous improvement where they weren't talking at all when we started, and now they're talking, and now they're interacting with family members. Is their speech perfect? No. But they can speak, and they can communicate, and their life is enriched because they can communicate and they can speak again. The amount of improvement an individual has if they have aphasia and apraxia, remember, the amount of improvement will be reflective of the amount of treatment, the amount of stimulation they get. And of course, we recommend that caregivers learn these methods because in many cases, people with aphasia and apraxia are going to need stimulation of speech and language for a year or more easily. And quite often, many of our treatment programs, they don't last that long. But that doesn't matter anyway because the amount of improvement a person makes depends on how much they speak with the new way of speaking. Once a therapist or individual figures out what they should be working on. So it's a very difficult question, how long it's going to take, what can I expect in terms of recovery. All of that depends on the severity of the aphasia, and then if there's apraxia also, that depends on the severity of the apraxia and whether or not both the apraxia and the aphasia are being worked on and by a therapist or a therapist who's teaching the caregiver what to do at home. So that's just a brief review of other factors that go into determining the prognosis, the length of treatment, what they can expect as far as a result of treatment, and there are many, many factors involved that one must examine. So this is Mark Ittleman, speech-language pathologist. If you've liked this little video, please give us a thumbs up. And just know that underneath this video are a bunch of links that will send you to our new book on apraxia, or our book on aphasia, or our video program on how to help someone with aphasia speak again. These are products like no other in the world today because very few therapists have really mastered methodology to help people talk, number one. And number two, very few have spent decades working on methodology, and many few have even written about it and developed an instruction manual for family members. Now, before I left hospital work, one of my major goals was to write a book that would be specifically designed for caregivers, because therapy ends and then they're left holding the bag and they don't know what to do. So that's why we decided to develop the Teaching of Talking method and to share it with people all over the world. We've made a book on aphasia, a book on apraxia, video programs, blogs, YouTubes, the whole business. So this will help you become an educated consumer so that you can help your loved one at home. The more you can help your loved one at home, the better the result you're going to get. So this is Mark Ittleman. Have a great day today. If you've liked this video, please give us a thumbs up, and you can always subscribe to us also. So check out underneath the video below the links that will help you learn even more about aphasia and apraxia and what you can do at home to help your loved ones speak. Bye-bye now.